Well, hello, my name is Mark Squires. I am the original Medicare Whisperer, but over the years, I've added some people to the team, like Steve Ford, as he's on the left, I'm in the middle, and Pat Clark is on the right, and you have joined the Medicare Whisperers wading through Medicare's alphabet soup webinar. Thank you so much for stopping by. I hope you enjoy this. We are here to answer questions, and we'll tell you how to reach out to us toward the end of this. Now, fasten your seatbelts, get something to drink, because this isn't going to take a long time, but it's going to be pretty intense. And I know you're going to enjoy the information once you see it. All right, let's see what we got here. Let's do the disclosure. We have to tell you that the Medicare Whisperer is a division of Wise Choices Financial. Neither the Medicare Whisperer nor Wise Choices Financial are employed by, authorized by, or certified by Medicare. They don't do that. Medicare and the Medicare Whisperer and the Wise Choices Financial, we are all separate, and we are not affiliated. Wise Choices Financial is not affiliated with the United States government or any governmental agency. You got that? All right, now we're legal. Let's jump into it. So I always like to start with, why in the world are we buying insurance? Because the truth is, you can't insure your health. You know that. It's not possible to insure your health. So why in the world would we buy anything that's related to health insurance? Well, the purpose of all insurance, whether it's your homeowner's insurance, your boat insurance, if you have one, for your insurance for your play toys, your nice vehicles, for your life insurance for your family, it's all about money. And the purpose of all insurance is to build a shield around your resources and your assets, your money and your stuff, so that in the event of a worst case scenario for healthcare, you're not financially devastated from expensive medical bills. And that's exactly why you're here. So let's take a look. What is Medicare? I get this question all the time. Mark, what is Medicare? You've heard about it all your life. You thought, oh, I'm going to get to 65. I'm going to have Medicare. Yay. Well, that's good. Medicare is a federal health insurance program, and it applies to people who are age 65 or older, certain younger people with certain disabilities, and people with end-stage renal disease. And it was signed into law about 5 miles from where I'm sitting right now at the Truman Library in Independence, Missouri. President Johnson flew into Kansas City and drove out to Independence to Harry Truman's office at the Truman Library to honor President Truman, because he is the one who originally proposed nationalized health care for senior citizens. So that was a nice way to honor President Truman. So now listen, I'm going to say this, and you're going to hear me say it more and more and more times. You probably care to hear, and the staff here at the office probably are sick of this, but it's true, true, true. There's no such thing as one size fits all, and that especially applies when it comes to your money and your health. So let's don't get into one size fits all. Look, I know you're getting ready to go on Medicare, and everybody in the world is giving you advice, and the post office is backing a dump truck load of advertising mail up and dumping it in your mailbox every day, and your phone's ringing, and people you don't even know are knocking on your door, and you go out and you have a nice visit with some friends or relatives, and they're telling you all about their Medicare and how it's set up, and your bunco partner has something that doesn't cost anything. And yeah, I get it. There's a lot of information out there. And I'm going to say this more than once. No such thing as one size fits all. This has to be about you. I know you spent your whole life being about other people, but finally something gets to be about you. All right. Now, I hear this all the time. Oh, I've got Medicare or Medicaid or something like that. Whatever. There is no whatever, folks. This is an important thing to remember. Medicare, like we said earlier, is federal health insurance offered to senior citizens, people over the age of 65, some people under the age of 65 with certain disabilities, and people with kidney failure. Medicaid is a completely different duck. It's still a duck, but it's different. It is public assistance. It is a joint program between the federal government and the states' governments, and it has benefits largely based on financial need, people who have limited income and limited resources, and it's paid for with public funds collected through taxes. That's Medicaid. So I don't know what you have or where you're at or what's going on in your world, but I'm going to say you're probably not on Medicaid. If you are, there's some special programs available for you, and we'd be glad to discuss that. In fact, we will touch on it later in the webinar. All right, so let's get started. What comes first in the alphabet, boys and girls? That's right, it's the letter A. Have you ever seen an A-frame house? That's how I remember this. An A-frame house is a building, right? Well, anytime you're receiving continuous care inside of a building, such as a hospital, skilled nursing facility, or even your home in some cases, it is paid for by Medicare Part A. A-frame house inside a building, that's what's going to cover it. It's hospital insurance. Good so far? There it is, letter A. Now, you're thinking, how much is this going to cost? Well, remember, it's inpatient care, all right? But for most people, there's no monthly premium for Medicare Part A. Why? How many years have you worked? If you've worked at least 40 quarters in your life, that's 10 years, you paid a little bit for this with every single paycheck, right? So there's no premium due for most people for Medicare Part A. Now, if you go in the hospital and you have just Medicare Part A with nothing else, the first $1,556 of room and board expense comes out of your pocket. And that is per benefit period. I'll tell you about that in just a minute. So room and board means the room, the TV, the bed, the support staff, and that awesome hospital cuisine. Aren't you excited? No? I can understand why. Now listen, that covers everything for the first 60 days, that 1556. After that, man, you're off the hook. What happens if you happen to be in the hospital for more than 60 days? Well, for days 61 through 90, you're going to pay $389 per day. And if you happen to be in the hospital for more than 91 days, you pay $778 per day. Now, I don't want you to panic. I can tell you in 20 years of doing this, I've only had 2 clients who have been in the hospital for more than 90 days. In fact, I spoke with one of them this morning and she's doing quite well. So don't worry about that. It doesn't happen very often, but at least you're informed and you are empowered, right? Knowledge is power. Well, only when you put it to practice, right? So there you go. 1556 deductible covers everything for the first 60 days. Co-insurance for days 61 through 90 is $389 a day, $778 for days 91 and beyond, and you have up to 365 lifetime reserve days. I heard you go, Mark, what's a benefit period? And I told you I'd tell about it. Are you ready? Say it with me. A benefit period from the time a Medicare beneficiary has received inpatient medical care until that patient has not received inpatient medical care for the same injury, illness, or malady for a period of 60 consecutive days. There's no limit to the number of benefit periods. True story. I had a client a few years ago, had a heart attack, right? He went in, they did the balloon thing, put a stent in, cool. He's in for a couple of days, change his meds around, do some physical therapy. Awesome. Doing really good. Getting better every day. 3 weeks later, oh my goodness, pain in the right side. Uh-oh. That was on a Sunday because we never feel pain during the week. Goes in the hospital and the next day they're pulling his gallbladder out. Well, now is the gallbladder related to the heart? Not in this case, it wasn't, and there's no way to connect the two for medical purpose, insurance purposes. So he actually had 2 benefit periods. By the way, he took our advice and he didn't have to worry about that, but that's how a benefit period works. Good so far? All right. Next part of Medicare is Medicare Part B, as in boy. Now take a look at that. Look at that. Have you ever noticed that there's 2 parts to the letter B, an upper part and a lower part? Well, that's kind of how the Medicare Part B works as well. Let's take a look at that. So this is outpatient care, things like your doctor's visits, specialist visits, durable medical equipment, walkers, wheelchairs, oxygen concentrators, lab techs, x-rays, MRIs, CAT scans, PET scans, cancer treatment. That kind of thing is covered as an outpatient service under Medicare Part B. For most people, there is a monthly premium of $170.10 for most people. There are some people who pay more because they're high income earners, but we're talking about the masses here, most people. If you happen to get a letter from Social Security or Medicare that says, we're going to assess you an IRMA penalty, that's IRMAA, and IRMA is not a house guest you want to have around. That stands for Income Related Monthly Adjustment Amount. Give us a call. We're pretty good at knowing how to explain those and seeing if there's any way to contest it and win. But for most people, for this webinar, we're going to talk about the people who are paying $170.10 a month. All right. Now, the first part of Medicare Part B is the preventive service benefit. And there's roughly 31 preventive services that Medicare pays 100% of the bill. Things like your annual wellness visit, your well woman checkup, your well man checkup, mammogram, pap smear, abdominal aortic aneurysm screening. Isn't that fun to say? Things like your flu shot, pneumonia shot, hepatitis B shot, and I could go on and on and on with the 31 categories where Medicare pays the bill and you don't. Well, there's a gotcha. There's always a gotcha. Isn't there always a gotcha? In this case, it's the colonoscopy. Yes, my friends, I have the only job in the world where I get to say gotcha and colonoscopy in the same sentence and get by with it. Well, if they do a colonoscopy and they don't find anything, that is preventive. But if they find polyps, they're not going to wake you up and say, hey, we found polyps. You want us to treat them? You already signed the paper. While you're taking your propofol nap, they're going to take care of the polyps. Make sense? Okay. So that rolls over to the other side of Medicare, the other part of Medicare Part B, the lower part, I say, and that's outpatient diagnosis and treatment services. Those services are subject to an annual deductible of $233. And it doesn't matter if you start Medicare in January or December, it's $233 annual deductible, not monthly, annual, once a year. Okay. Now, after you've met that deductible, everything else for the rest of the calendar year is 80-20, meaning Medicare pays 80% and you pay 20%. Now, do you know why most people talk to my team here at the Medicare Whisperer? Because they know that there's no maximum out of pocket for the patient on that 20%. Now, I'm not trying to scare anybody. This is just easy math. But if you have a $500,000 cancer claim, you're on the hook for $100,000. Can you write that check? Well, you might be able to, but do you want to? No, you don't want to write that check. That's how we help people build the Medicare around them, the shield, remember the shield, so that things work well and they're not financially devastated. Okay, so like I said before, things like doctor's office visits, specialist lab tests, x-rays, MRIs, CAT scans, PET scans, outpatient services, durable medical equipment like walkers, wheelchairs, oxygen and oxygen concentrators, diabetic testing supplies, prosthetic devices and braces, and more. Call before midnight. No, don't call before midnight. Okay, that's Medicare Part B, diagnosis and treatment services. Makes sense so far? I got A, that's hospital insurance, inpatient care. I got B, that's outpatient services. Two parts to the letter B. The first part's the preventive benefit. The other part is outpatient diagnosis and treatment services. See, folks, this isn't nearly as confusing as people make it out to be. Now, by the way, you can watch this webinar as many times as you want. I realize that I'm going at the pace of a bad auctioneer, but you can come back and watch this as many times as you want. Even more importantly, you can come in and we'll do this for you live a little bit slower in the office. Sound good? All right, so we got A, we got B. What comes next? Very good, I'm proud of you. C is what comes next, and that is the Medicare Advantage program. Folks, when you see these commercials on TV, you know, free this and free that. No, look, that's the Medicare Advantage program, all right? I am not against it, I'm not for it. I believe in creating plans built around my clients and their lifestyle, their budget, and their health. So the Medicare Advantage plan we need to talk about, all right? So what is, it's a way of combining parts A and B and sometimes part D into one card. What you're doing if you enroll in a Medicare Advantage plan is you are hiring an insurance company who has a contract with Medicare, but that insurance company is going to administer your Medicare payments for the rest of the year. Make sense? Not rocket science, is it? So most Medicare Advantage plans have very low premium. I'm in the Kansas City area. Those premiums in our area are anywhere from $0 to about $80 a month, I think. There are some plans available in Kansas City that will actually give you part of your Medicare Part B premium back. There's some stipulations there. One is none of those plans cover prescription drugs. So if you have other prescription coverage, that might be good for you. We'll talk about that in just a minute. Okay. By the way, you see that little asterisk at the bottom and it says Part B premiums must be paid. They must be paid every month. Unless you're extreme low income, then there may be a way to get that paid for you. All right. So there's 5 different kinds of Medicare Advantage plans, and we need to go over this, even though you probably don't want to. First kind is HMO, Health Maintenance Organization, and just like every other HMO in the world, or in the country anyway, you sign up for this, you have a network of providers. All right. And in order to get your medical care, you must go to a provider who is in that network. Except in an emergency, you do have worldwide emergency room coverage on Medicare Advantage plans, at least all the ones I've ever seen. Otherwise, if you're on an HMO, you're in network and that's it. If you happen to go to a doctor who's out of network, it doesn't revert back to Medicare, it reverts back to your bank account. So if you're going to Dr. Knows More and Dr. Knows More wants to have you see a specialist, Dr. Knows Even More, you want to make sure they're in network. Now, how do you do that? First of all, Dr. Knows More staff doesn't know if they're in network for your plan or not. And Dr. Knows Even More staff has no idea. If you call them and say, do you take this plan? They'll say yes. They don't know. I mean, they know they take the plan, but they don't know if they're in the HMO network. So how do you do that? If you have an HMO, check with your broker, check with us, or call the company and ask them. That way you don't get a surprise bill, because let me tell you, there's no going back on that. Now, after the HMO, you have the PPO. It's called a preferred provider organization. And just like every other PPO in the country, you do have a network of providers you can use to get your lowest cost for healthcare. But in the case of a PPO, you can go to a provider who is out of network. You just pay more for the service. Instead of a flat copay, you may pay a 35% coinsurance rate. That's not too bad, is it? Well, it's your bank account I'm playing in. It's easy for me to say. So if you're a traveler, if you've got some grandkids in the Upper Peninsula of Michigan and some grandkids in New Mexico, and you're going to go visit and spend too much in each place, may I first of all suggest that you spend the summer in the Upper Peninsula of Michigan and the winters in New Mexico, but you're going to have coverage wherever you need it. By the way, the PPO has nationwide and worldwide emergency room coverage. Good so far? Next is the private fee-for-service plan, PFFS. These are really set up more for rural areas. These companies have worked to build rural provider networks. You know, if you live in Texas County, Missouri, there's only 2 medical providers in the whole county. So Gary, if you're watching this, how are you? So private fee-for-service plan, you can get one of those if you live in the city, in a major metropolitan area. There's nothing wrong with it. And in fact, the rules are you can go to any provider in the country who accepts Medicare, but if they're not in network, they can choose on a case-by-case, day-by-day, and patient-by-patient basis whether or not they'll accept the plan. Now, I don't know how you feel about risky stuff, but that sounds pretty risky to me. So if you're interested in that, we can talk to you about it. We don't have a lot of them on the books. Okay. Next kind is a chronic special needs plan, or we call them CSNPs in the business. These are plans that are made and they're built for people with certain chronic illnesses. In the Kansas City area, that's diabetes, congestive heart failure, and COPD. There's different plans across the country that deal with different illnesses. But for our area, those are the 3. And those plans have more case manager services available for people with those illnesses because they want to help you control those illnesses. Make sense? And then last, we have the dual special needs plan, or what we call a DSNP. These plans are built for people who are on Medicare A and B and full Medicaid with their state. These plans have some really bonused up or bumped up extra benefits like dental, vision, hearing, over-the-counter benefit, transportation, that type of thing, because generally speaking, the dual special needs community needs that extra help. Good so far? I got A inpatient, I got B outpatient, I got C, put the A and the B together, and most of the time the D, and we're going to talk about the D in just a minute. All right, so how do Medicare Advantage plans work? All right, well, like I told you before, you have networks of providers, especially on HMOs. If you have a major illness, say cancer, heart attack, stroke, something like that, your doctors and the doctors at the care centers are going to have some input, but by and large, you have a case manager at that company who's going to be making decisions on your behalf. Okay. Many of the Medicare Advantage plans have extra services, things like dental and vision, hearing aids, health club membership, over-the-counter benefit, and there's some others out there too. So that's kind of the basics on Medicare Advantage plans. Okay, now let's talk about the only thing in all of Medicare that I've found in the last 20 years, well, 17 years since it's existed, where the letter matches what it covers. And D stands for drugs. Part D is for drugs. Now, you got to have drug coverage. Medicare, Congress said so. We'll talk about that in a second. So what kind of drug coverage is good if you're on Medicare? Is creditable, is allowed? Well, first, VA. If you are a veteran, number one, thank you for taking my place and thank you for your service. But if you are taking advantage of your veterans benefits, and folks, if you're not, you need to do it. Remember that day when you raised your right hand and they said, I state your name, and you actually got your name right? We made a contract with you to help take care of you. So it's not about some other guy deserves it more than you. Okay. Take advantage of those benefits. Go sign up and check it out. Right. But if you have VA benefits, you have creditable prescription drug coverage. Some people may have employer or retiree coverage that has creditable drug coverage. Some unions offer retiree coverage that is creditable for Medicare Part D. But if none of the 3 of the above apply to you, then you will enroll in what's called a Medicare Part D prescription drug plan, or what we call a PDP. Good so far? Now, PDPs, Medicare has issued guidance on a minimum standard plan. Now, once a company has a plan that meets the minimum standard, they can embellish it in different ways. But I'm going to talk to you about the minimum standard. So Medicare Part D has an annual deductible. Currently, it's $485. Everything in a Medicare Part D plan is based on the retail price of the medication. So if that drug is $10, but your plan only requires you to pay one, we're talking $10. So you pay the full price till you met the deductible. After you've met the deductible, you have what we call the initial coverage phase. Now, all Medicare Part D plans are formulary based. A formulary is a list of drugs that the plan will cover. They're quite thick, actually. And they divide those medications into 5 categories, or what we call tiers. Generally speaking, the lower the tier, the lower the cost of the drug. So a tier 1 drug is a preferred generic medication. A tier 2 is a standard generic. A tier 3 is a preferred brand drug. These are drugs that have been out for a while, but they're still under patent. Tier 4 is a non-preferred drug. I call those the TV drugs because if you have to ask your doctor if it's right for you, it's probably a little bit expensive, wouldn't you say? Yeah. So in the initial coverage phase, you're going to pay a copay or co-insurance based on anywhere from 0 on those preferred generics. I've seen as high as 47% on the tier 4. Now, I want a little word about generic drugs here. All right. Generic drugs can be found on any of the 5 tiers. We've had it beaten into our heads: buy generic, buy generic, buy generic, buy generic, right? And that's good because we want to save money. But it's not unusual for us to get a call from a client going, I just picked up a drug that's generic, but it was on a tier 4 and it cost me $60. Well, not all drugs that are generic sit on that tier 1 or tier 2, especially opioid-based painkillers, and you probably know why. All right. Now, once you've eaten up your initial coverage level, you go into what we call the coverage gap. We used to call it the donut hole. And in the coverage gap, you would pay 25% of the retail price of the medication, whether it's generic or brand name. So if it was a $10 drug, you'd pay $250. If it was a $1,000 drug, you'd pay $250. Make sense? And that lasts until we get about $7,000. I don't remember the exact number, but we'll be glad to give it to you when you call in. Then you go into what we call catastrophic coverage. Now, catastrophic coverage, you've spent a lot of money on drugs to get there. Now, in catastrophic, you will pay 5% of the cost of the drug, but only if that 5% exceeds $3.95 for generic drugs or $8.95 for all other drugs. And that number may have changed, but you get the idea. All right. You see that? I put that up there because to remind me to tell you that way back in 2005, Congress did something. I know, it's crazy. They did something. They actually got something accomplished. And what they did is they said, if you are on Medicare, you have to have prescription drug coverage, even if you don't take any medications. Now that, folks, is called a mandate. Well, they put some wording in there, say, well, it's really not mandatory, but if you decide, it's voluntary. But if you decide 5-6 years from now that you want to enroll in a plan, they're going to charge you a late enrollment penalty. And the late enrollment penalty is defined as 1% of the national average Medicare Part D premium multiplied times the number of months that the Medicare beneficiary did not enroll in coverage when they were first eligible. English translation, that's about 34 cents a month times every month that you did not enroll when you were first eligible. That can add up pretty quick. So think about that. Okay, we're not telling you have to have the coverage. We're telling you that Congress wants you to have the coverage because you might need it. I don't know. I don't know anything about you. I just know you're watching this, and I hope you're enjoying it as much as I am. All right, so where are we next? A, remember that was inpatient care, right? B was outpatient. Top part of the B was preventive. The bottom part of the B was diagnosis and treatment services, a good way of combining A and B, and most of the time D, into one card, and getting some of those extra benefits like vision, dental, and health club memberships and over-the-counter benefits. That's Medicare Part C, the Medicare Advantage plan, and then Medicare Part D, D for drugs. Got it? Not nearly as complicated as you thought it was, especially when you're working with brokers like us at the Medicare Whisperer, because we will take this and we will build it around you, not just say, here you go, sign here, here's something good. All right, makes sense? Now, outside of that Medicare Foursquare game, we have something called the Medigap program. That's the official Medicare term, is Medigap, fills in the gaps in Medicare, right? Now, some people call them Medicare supplements. I have family in the South that call them tie-in plans. The official term is Medigap, so that's what we're going to use. Now, if you look in that left-hand column where it says benefits, those are the things that people typically pay out of their own pocket if they're on straight Medicare with nothing else. So Medicare Part B coinsurance and hospital costs, remember that days 61 through 90 and days 91 and beyond. Well, if you look at that chart, you see all the way across there, 100%, 100%, 100%, right? And at 100%, that means if you have a Medigap policy and you go in the hospital, you're not going to worry about paying those extra charges. Medicare Part B coinsurance, remember that was the 20%. Well, most of those plans have 100% coverage there. We'll talk a little bit more about that in a minute. Blood, Medicare doesn't pay for the first 3 pints of blood. So bring your own bottle, folks. Again, you can see across there, most of those plans are 100%. Part A, hospice care or coinsurance. Hospice organizations are allowed to charge coinsurance or copays. Frankly, I've never seen it done. I think it would probably be a PR nightmare, but they can. And if you do have a Medigap policy, you'll see 100% coverage there. Skilled nursing. Now, I want to make a point here. Skilled nursing is not a nursing home. It is rehab after you've had some hospital services or an event. So skilled nursing is its own animal. And Medicare says if you've been in the hospital for 3 days, by the way, a day in the world of Medicare is midnight. So if you've been in the hospital for 3 midnights and your doctor deems that it is necessary for you to go to a rehab center or skilled nursing, Medicare will cover the first 21 days of skilled nursing at no charge to you. Days 21 through 100 do have a daily copay assessed to them, all right? Now, Part A deductible, remember our $1,556. By the way, how long does it take to run up $1,500 at the hospital? Do they have yet? Hello? Probably so. Anyway, you can see the Part A deductible. Most of the plans there have 100% coverage for that. Now, the Part B deductible, $233. Well, we're going to talk about that in just a minute. But if you started on Medicare after January 1st, 2020, you are not eligible for either one of those plans that you see in that pinkish color on there. And we'll talk about the macro rule in a minute. Part B excess charges. There's 2 different ways that a medical provider can sign a contract with Medicare. The first is whatever Medicare says they'll pay, they'll accept. So you go to Dr. Nosmore, you got a horrible sinus infection, and Dr. Nosmore says, well, here's an antibiotic, and take these and you should be okay. And Dr. Nosmore sends a bill to Medicare, and let's pretend for the sake of our conversation that bill is $250. Medicare comes back and says, Doc, based on the billing code you use, we'll pay you $75. And Dr. Nosmore says, I signed the contract, I'll take it, thank you, Medicare. Now, the other kind of contract is a non-assignment. Assignment and non-assignment. And a non-assignment provider can balance bill the patient up to 15% above Medicare's contract rate. All right. We'll tell you on a slide here in a minute that approximately 5% of all Medicare contracted providers in the United States are non-assignment providers. So we tell people, don't worry about this. Okay. And then foreign travel, we'll talk about that a little bit more, but some of the Medicare supplement plans and Medigap policies cover foreign travel. I'm kind of iffy on that because what you have to do is you have a deductible. You have to remember to get a receipt and a copy of your medical records and bring them home and mail them in with a form, and then wait for them to process the claim and send you a check and hope that the exchange rate didn't go in the tank while you were waiting. So yeah, it's there, but my advice is if you're going to travel internationally, don't depend on Medicare. Seriously, don't. Get the foreign travel emergency insurance. Medicare won't cover repatriation, and those plans usually do. If you ever have questions about that, reach out to us. We offer that too. So the macro rule, once again, Congress did something. Yes, they did. Yay, Congress. Okay. So they said nobody who is starting new to Medicare after January 1st, 2020 is eligible for first dollar coverage. And that's the C and the F plan. So if you've been on Medicare for a while and you want to get one of those, that's great. We can help you. They're a little pricey because that risk pool is getting smaller and smaller and smaller over time, but we can help you with that. Okay. So plan C and F, they're both restricted. And like I said, those premiums are getting pretty expensive. So the common choices you can see in the yellow and the green there are the G and the N plan. We can certainly have a conversation about the others, but these are the 2 that we find most people are interested in. Now you can see in that column, in the G plan column, the yellow one, 100% down the line, except for one little bitty blank square, and that is the Medicare Part B deductible. So if you have a G plan, you're going to have 100% coverage on your medical care, with the exception is you're going to be responsible for the Medicare Part B deductible of $233. By the way, that number changes every year. We'll update it next year for you if you want to know. Now, over there in the green, way over there, you can see that the N plan is listed. And a lot of our clients go for the N plan. They're a little bit lower cost than the G plan. N plan, you can see I've got 100% down the line. I got two blank squares down at the bottom, right? The first one is Medicare Part B deductible of $233, just like the G plan. And the other one is excess charges, which we just said we're not going to really worry about. But do you see up there the second line down that says Medicare Part B coinsurance, and you see a couple of asterisks there? Thank you, Miss Boise, my fifth grade teacher, for making me learn how to say asterisk properly. So let's look at the footnote, because when there's a footnote, you got to chase it. You got to read it. So down at the bottom, it says Plan N pays 100% of the Part B coinsurance, except for a copayment of up to $20 for some office visits and up to a $50 copayment for emergency room visits that don't result in an inpatient admission. Now, if you're like me, I see the words up to. Do you know what I think? That's just the number. Now, that actually depends on the billing code used and how long the provider spent with you in the exam room. For most people, the average for the Kansas City area we find is about $16 copayment. If you do go to the ER and you're not admitted, you're going to pay a $50 copay. Still not too bad. Have you seen an ER bill? $50 is cheap. All right, makes sense? Again, this is about you. There's no such thing as one size fits all. I can't tell you that everybody should have a G or everybody should have an N or everybody should have an Advantage. I don't know, because I don't know you. Now, remember, you can't get that first dollar coverage. It's gone. That's why they're blacked out. All right. So let's just do a quick review of the Medicare numbers. Part A has a benefit period deductible, $1,556. Then your coinsurance for days 61 through 90 is $389 a day. Days 91 plus, $778 a day. Okay. So the first 20 days, Medicare's got you handled. But days 21 through 100 will be $194.50 a day. And at day 100, if you're still in, you're out. Medicare will only cover up to 100 days of skilled nursing per benefit period, provided the patient's condition is improving and there's a reasonable expectation of recovery. If you're not improving, they're not going to continue to pay for it. And remember what I told you, this isn't nursing home care. This is skilled nursing or rehab care. Medicare Part B has a monthly premium of $170.10 for most people, has an annual deductible of $233. The coinsurance after the deductible is met is 80/20. Medicare is going to pay 80%. You're going to pay 20% of the bill. There could be excess charges depending on how your provider is contracted with Medicare. Okay, good so far. About 5% of medical providers in the U.S. charge excess charges of up to 15% above Medicare's reimbursement rate. 5%. Are we going to worry about 5%? No, we're not, unless it's inflation. And inflation is not 5%. Foreign travel, Medicare only covers care within 20 miles of a U.S. border or within 6 hours of a U.S. port of call if you're on a cruise ship. Have you ever been on a cruise ship? They run about 15 miles an hour. So if I multiply 15 times 6, about 100 miles, right? So that should tell you what you need to know. Medigap foreign travel emergency is subject to a deductible of $250. Beneficiary must pay for services when they're rendered, and remember to get a receipt and their medical records and submit for reimbursement when they return to the United States. Foreign travel emergency health insurance is available either through your travel agent or through us at Wise Choices Financial. I highly recommend you look into it. It's cheap. A few years ago, my wife and I were blessed to go to Australia, and I bought a policy for each one of us, and it cost me less than $75 for both policies. And the thing is, those cover repatriation. So if something really bad happens and you need to be medevac back to the U.S. soil, that's expensive, but those policies cover that. All right. Okay, so on Medigaps, we're talking Medigaps now. You don't have any networks to deal with. The rule is, if you have a Medigap policy, you can go to any provider in the country who accepts Medicare, and they have to accept your Medicare supplement policy. All right. They're just not. Now, there's something called a Medicare Select policy. We really don't get into them too often. They do have networks. Truthfully, if you come in and you want one of those, we'll probably try to talk you out of it, because why would you want to pay for no networks and then have a network restriction? The savings isn't that great. Okay. So with a Medicare supplement policy, You can get medical services from any provider in the country who accepts Medicare assignment. Okay. Now, you remember where we started. This is your pop quiz, boys and girls. The purpose of all insurance, whether it's on your house, your toys, your vehicle, your life, your health, so that you're not financially wiped out. The purpose is to build a shield around your resources and your assets, your money and your stuff, so that if one of those expensive medical instances comes up, you are not financially devastated, wiped out. Okay. Just think about it. If I ask people a lot of times, what in your mind is an expensive healthcare event? A lot of times I hear cancer, heart attack, stroke, dementia, and one guy said getting hit by a train, but that's another story. Ask me about it when you come in for your appointment. People will tell me cancer, and I'll ask, why do you say that? Well, my mom and my sister and my grandma all had breast cancer, and I've got the gene. And so, well, what do you think a breast cancer event would cost in terms of medical? And people say $300,000 or $400,000. Well, 20% of $300,000, folks. 10% is 30, 20% is 60. Do you want to write that check? No, you don't want to write that check. All right. All right. So here are the things I want you to remember. And if you're working with us, this will be part of our conversation. If you are working with another broker, you need to make it part of the conversation. What's your lifestyle? Are you a homebody? Are you a person who says there's no such thing as too much fabric? There's just not enough space to store it. You quilters out there. Are you a person who's going to travel? You're going to get in the car and you're going to, we're going to do a waterfall tour. We're going to see all the waterfalls in 7 states in 2 weeks. One of my best friends just came up here to visit from down south. Recently retired. Okay, cool. So what is your lifestyle? Number 2, what's your budget? Because it doesn't matter. If you can't afford it, why would we put you on it? We don't want you eating cat food. And I don't care what you say about canned tuna, it's cat food, right? And finally, your health. Now, Medicare actually restricts us from having too much of a conversation about that because they don't want us to cherry pick plans. I don't know how you could do that, but Medicare says, no. That's voluntary on your part. We find that most people want to tell us about their health so they can get the coverage built. That is for them. Like I said before, there's no such thing as one size fits all when it comes to Medicare or pretty much anything else. Look at these hands. It's hard for me to buy gloves, right? So when you're getting into this, it's not about your uncle, your sister, your aunt, your neighbor, your coworker, your bunco partner, your bridge partner. I'm glad they all have their experience, and I'm glad that they're willing to share it with you. But the bottom line is, based on budget, lifestyle, and health, we need to make a plan. We need to build a plan that is centered on you because you are who is important in this equation. You're talking with somebody else and all they're talking is numbers and benefits, sign here, and they haven't taken time to get to know you. You need to move on. I promise you, if you come in here, we're going to talk about you. All the years that you've been about everybody else, helping everybody when they need help. Finally, it's time to talk about you. Does that make sense? I hope so. So you're like, Mark, this has been fun. I hope it has. I want to get a hold of you guys. We don't charge for Medicare consultations. I'm in the business in my 20th year. I've never charged for Medicare consultation, and I'm not going to start charging with you. Partially because it's against the law, and I don't want to live in that kind of a gated community. Regardless, we want to talk to you. We want to help you. You can call us at 816-399-4871. You can send us an email at team@wcf-kc.com. We're located in the Kansas City area, conveniently at roughly the intersection of Interstate 470 and US Highway 40. You can also chat with us or check us out at lifewithmedicare.com. We would invite you, if you want to, check us out on social media. The Medicare Whisperer, we're there at Facebook and Instagram and Twitter and LinkedIn and YouTube. It'd be really nice if you hung out with us there and saw some of the stuff we do. And I hope you found this webinar helpful. On behalf of my team here, and there's 6 of us, there's me, there's Steve, there's Cassie, there's Pat, there's Jocelyn, and there's Bonnie. Thanks for watching. Remember, you can watch us again if you want to, but the most important thing is give us a call, set up a visit. We can do it by Zoom. We can do it on the phone. We can do it in person here in our office. I can't make it any easier than that, can I? Hey, thanks for watching. This is Mark Squires, the original Medicare Whisperer. I'll see you soon. Bye now.